Namaste everyone and welcome to my short video presentation. I am Dr. Ravi Pudasaini, one of the HIM International Emergency Medicine trainee and an associate member of Royal College of Emergency Medicine. Currently, I am practicing emergency medicine in Chitwan Medical College and Teaching Hospital. In this video, I will be talking about my quality improvement project. My thesis title is Exploring the Performance of National Audio Warning Score 2 among all the adult patients presenting to Emergency Department of Chitwan Medical College and Teaching Hospital. As we know that, evidence shows that about one-third of potentially preventable deaths are related to poor clinical monitoring and other can often be attributed to an inadequate response to clinical deterioration in terms of the urgency of response, the clinical experience and the competency of responders, and ensuring that the patient is in the most appropriate setting for the ongoing clinical care. There are no widely used scores specifically designed to detect deteriorating patient or to predict the chance of early intensive care unit admission or death in emergency department patients. As an emergency medicine trainee, I have encountered lots of serious adverse events such as an unexpected cardiac arrest and unnecessary ICU admissions. Now, let's begin with our patient story. Bahadur, 45 years old male, hypertensive, presented to emergency department with the complaint of upper abdominal pain for 45 minutes and shortness of breath. Vitals and trials were blood pressure 90/60, pulse 130 beats per minute, respiratory rate 26 breaths per minute, saturation 96% on room air. The patient was allocated in the yellow zone of emergency department. After 30 minutes of arrival, the patient was found in an unconscious state. He had no palpable carotid pulse and spontaneous breathing. Hence, cardiopulmonary resuscitation was started. If you had followed News2 scoring at trials and at arrival to emergency department, it could have indicated the urgency of response, including the frequency of clinical monitoring required. News2 scoring is a standardized scoring system that helps to determine and quantify illness severity to support consistent decision making and an appropriate clinical response. It measures 6 physiological parameters including respiratory rate, oxygen saturation, systolic blood pressure, pulse rate, level of consciousness or new onset confusion and temperature. Hence, I will be using News2 scoring system for all the patients presenting to emergency department. As we are not currently using News2 scoring in the trials and department, we are frequently compromising patient safety. Hence, I have process map to improve quality of care provided by News2 score. All the adult patients presenting to emergency department will be assessed with News2 score. This will help duty doctor and nursing staff for subsequent monitoring, management and critical care team involvement according to total score and triggers of News2. Now, let's discuss about the study performed in Norway which concluded that with a mean News2 of 7, ICU admittance rate was 56.8% and mortality was 16.8%. They had a shorter emergency department length to stay, in particular if admitted to ICU, suggesting that the management by a multidisciplinary team may be beneficial. Higher News2 on arrival as well as being managed with critical care interventions and medications were factors associated with ICU admittance. For my thesis, patient information will be obtained from the patient or their relatives after obtaining verbal and written consent form. I will be using self-structure performa. Confidentiality of the information of the responders will be maintained by not disclosing the information, storing in the private laptop, and by using it for study purpose only. The data will be entered and analyzed in IBM SPSS 20 version. It will be summarized using descriptive analysis and presented in the form of relevant pie charts and bar diagrams. My research study will be developed further as a quality improvement project by collecting data over a period of 6 months for statistical process control charts to be developed. This will create eligibility for my research to be published by using Square guideline. I will be doing a PDSA cycle, stakeholder analysis, fishbone analysis, and establishing experience-based co-design for staff motivation and improvement of quality of patient care, thus ensuring patient safety. Now you can see my work plan from second to fourth year on the screen. Thank you.